All right, you guys, round two. Excuse the camera angle. I'm trying to get this as best I can for you guys to see. So I'm now going to perform for you application of ultrasound. I'll kind of show you guys the technique that we go through and kind of our necessary safety features in order to make sure we're applying it correctly. I have my parameters set up here. I'm gonna do my medial Achilles tendon here. I am targeting a tendon because it is highly collagenous. Perhaps if a patient has restricted dorsiflexion range of motion, could be coming from tight gastroc or potentially some adhesions. So I can increase our soft tissue extensibility with some thermal effects. If you really want to get some great soft tissue lengthening, you can actually apply your ultrasound while the patient is in a stretched or a lengthened position. So I were to place my position or my patient in a little bit of extra dorsiflexion and into a stretch while I'm applying the ultrasound, because that way as the tissue heats up, you can kind of get a little more length, a little more length, as we have those viscoelastic properties. So I am going to use a frequency of 3.3 megahertz. I'm pretty bony. My tendon is pretty easily exposed here. I don't need to go all that deep. So I'm talking about my 1 to 2 centimeters here. So I chose a higher frequency. I want thermal effects because I'm looking for increased tissue temperature to improved soft tissue extensibility. I for sure want to be on watts per centimeter squared, and I chose my intensity here. I have utilized ultrasound before. I know that I can tolerate a higher intensity. So because I'm going on a superficial range here, I can go anywhere from 0.5 to 1.0 watts per centimeter squared. So I chose my higher end for more intense effects. And I'm just going to do 5 minutes so that you guys can see, but my treatment area is going to be no bigger than 2 times the size of my ERA. So when I'm looking at my transducer head, I'm going to stay from right here to right here. This is my treatment area. Okay. And so 5 minutes will be adequate for that size of an area. If I were to go bigger, I would need more time. Okay, so that's where I'm gonna get started with. So I'm gonna set you guys up here. Excuse my camera. Okay, so a couple of things that I need when I am set up. One, my patient has to be in a comfortable and supported position. If I were to place them in a stretch, I would have to put them somewhere, somehow, that they could be in a dorsiflexion stretch. I'm obviously doing this on myself, and I need all the hands I can get to do that. 3 things that I need before I get started. I need alcohol preparation pads. Cross-contamination is a potential adverse effect that we can have with our ultrasound, so we need to make sure that we are disinfecting and cleaning everything as best we can. So I have 2 because I'm going to need 1 for my patient and 1 for the ultrasound head. Okay. I also need to have my ultrasound gel with me. We can also use lotion, and we'll also learn about phonophoresis, which is, excuse me, Kedzie, which is administering medication via ultrasound. So that can be another thing that goes on in with your gel medium here. So I'm going to use gel rather than lotion. I also need some towels on hand. Ultrasound can get very messy. Not only do I have a towel kind of underneath my treatment area here, if you are in an area that requires you to expose skin or to kind of be near a patient's clothing in any ways, I'm going to show you right now. If I was going to go up in this area, usually my little trick here is that I'm going to tuck a towel underneath so that I don't risk getting any gel on the patient's clothes. It does not do well with clothes. So please make sure that you are protecting the patient's clothes, protecting any other clothing or cloth that is nearby, okay? So for this one, because I'm resting my foot up here, I'm just going to go underneath so I don't get it on my pants. Okay, so I'm going to be doing this small area here just along my Achilles tendon. You need to make sure you're in an area that is flat enough that you can maintain a good coupling, that you can maintain a nice flat position of your ultrasound head. We always want a flat position of our ultrasound head. When and if I ever get any tipping of my ultrasound head, that gives us potential to crack our crystal. Our crystal always has to be vibrating when it has good, solid contact. If it doesn't have a medium to travel through, those ultrasound waves can overwhelm the crystal and crack it, which we talked about, $500 at least for this lovely ultrasound head. You do not want to be responsible for cracking it at the school or at your future employer. Okay, so make sure that you always have good, flat contacts, and I will show you how to do that. Okay, so for this guy, we're going to clean off. First ultrasound pad or first alcohol pad, I'm going to clean off my patient's skin in the immediate area. Okay, anything that I might touch, avoiding cross-contamination here. That's one ultrasound alcohol pad. Second one, okay, I'm going to clean off my ultrasound head. Okay, clean off your ultrasound head. Always being careful. I'm going to get all sides, all edges here. Okay, front, back, around the sides. Okay, anywhere that might touch my patient. Okay, we are avoiding cross-contamination. Okay, there are my alcohol pads. those to the side. Okay, great, that is clean. Next thing I need to do is apply my gel. Okay, apply my gel. So some of these tops are a little bit different, guys. Sometimes you get need a little bit extra pressure to put in there. More is more. There is no such thing as too little gel. We always have more gel. Your patient, again, one of your negative and adverse effects or something that your patient may feel during would be a stinging, prickling feeling, and that would be if you did not have adequate gel present. There always has to be a good solid connection between your transducer head and the patient's skin with the medium. Okay, there always has to be medium as your mediator. Okay, keep your gel on hand, keep it close by. You may need to kind of add more as you go. Okay, so plenty of gel. Sometimes if you're in these crazy contoured areas, the gel is going to slide off. Doesn't mean you stop your treatment. It just means that maybe I choose to pause and kind of scoop my gel as it goes. I cannot ever lift my head off of the patient's body while the ultrasound is running. So right now it is not on. When this ultrasound head is on, you guys, there will be a little green light here. That means the crystal is vibrating and it needs to constantly have contact and a flat head against your patient's skin. Okay, I cannot be tipping it. I cannot be lifting it up to move and utilize the gel here. That is when you risk shattering the crystal. Okay, because the ultrasound, that energy needs somewhere to go and it has to go into the patient. Okay, so before I start, I'm going to move my gel. I move my gel around. I kind of spread it out so that I help myself kind of determine my area here. So I'm staying here within kind of my 2 ERA as best I can. I am going to be aware of the fact that I am kind of right by that medial malleolus, you guys. We talked about another adverse effect could be potential periosteal burning. That's a very high collagen concentration, and you need to make sure that you're keeping a consistent and moving away from the bone. And if you are feeling any burning, that's when we potentially need to turn our intensity down. But I'm going to try to stay away from it because it can be a little bit tender or feel a little bit achy, and we don't want to have any periosteal burning. Okay, so I've decided my treatment area. My ultrasound head needs to be moving upon start and upon stop. I can't hold my ultrasound head here and press my start button and then start moving. It needs to be moving upon start to prevent any hot spots. If I am looking over here and I start it and then I don't start moving, I am concentrating all of that energy in one spot, and it can be far too intense and we can cause burns. Okay, so I need to be moving upon start, and if I'm going to go press pause, I need to be moving until I see that light go off. When this light is on, this ultrasound head needs to be moving. Okay, so I'm going to control. I've been moving my gel around without even starting yet. Okay, all my settings are good. I always double check. Great, I'm in a position, my patient's in a position. I've explained to my patient, okay, that they should not feel any stinging or any prickling. They should not feel any sharp aches or deep aches, okay? If you feel any of these things, that you need to let me know, okay? The most you should feel would maybe be a light warmth. Otherwise, you won't feel anything. It might just feel like I'm pushing gel around, okay? So the most you may feel should be a light warmth. If you feel anything other than that, please let me know, okay? So I am moving right now. I'm starting my moving. Okay, here's my area, and I'm going to press my start button, which is right at the bottom here. Start. My green light is on, okay, and my ultrasound head is moving. Small circular movements, you guys, there's no science to this. Keep it moving. I sometimes draw little figure eights. I do little circles, but it needs to be moving, and I'm staying within kind of my 2 ERA radius here, okay? That's how I get to do my 5 minutes. If I start moving outside of this, I'm not getting adequate effects to my desired tissues. Okay, you can literally see I'm kind of drawn here, okay? As I am running out kind of gel here, okay, I can always choose, again, I'm still moving here, guys. I have a pause button up here in the middle. I'm gonna pause. I see my ultrasound head went off, so that means I can lift it up. I'm gonna bring this up to show you guys real quick. Sorry. Okay, so I have a start, a pause, and a stop. If you press stop, it will clear your settings. Okay, so if you still have treatment to go, you need to be sure that you have paused. Okay, this indicator light is your friend. Okay, you need to know I cannot stop moving, or I cannot start moving, or I must be moving when the light is on. Okay, I'm gonna bring this back here. Okay. I pause because I want to move some of my gel back around. I want to bring it back to my center here. Okay, and I have to pause in order to do that because otherwise my head can't be flat, right? So I'm just gonna use it, scoop it, bring it back to the middle, okay? It's a messy thing. All right, great, brought it back to the middle. Okay, I am moving again. I'm gonna press start again. Here I go. I have a nice flat head. Okay, I brought all my gel back to the middle. All right, I forgot to bring tongue depressors home with me, you guys, but we can use tongue depressors like those popsicle sticks when the doc tells you to stick your tongue out to move some of our gel around. If you get a little dexterous with it, you can use your left hand while you're moving your ultrasound head in order to kind of scoop your gel back to where you need to be. Sometimes it takes a little practice and a little coordination to do that. The key is that you're keeping this head moving. So if you're not able to walk and chew gum, meaning if you're not able to keep your ultrasound head moving and use your tongue depressor to move your gel, there is no shame in your game if you need to pause, make sure my light went off, and move your gel like this. Okay? It's all about the patient safety, and it's all about making sure that there's always good contact when that ultrasound is on. Okay? So all I did was move all my gel back to the middle again. Great, lovely. Okay? Moving again. Here we go. Light's back on. I had to be moving when my light came back on. All right, if for whatever reason my patient was feeling stinging, all I have to do is reach for my gel. Okay, I'm keeping moving, you guys. Keep it moving. Put some gel right on there. Lovely, great. Okay, helps move it around. Nothing wrong with that. Okay, oh, there goes the gel. All right, just make sure you keep moving and keep this head flat. Those are the keys. All right, great, blah, blah, I'm counting down. Okay, so I'm gonna stop my treatment so you guys can see what it looks like at the end of my treatment. Stopped my treatment. Again, wait until this light goes off before you take your contact away, okay? So here is the end of my treatment then, okay? So I did my 5 minutes, all right? My intensity, 1 watts per centimeter squared, there's everything there for me. Lovely, completed. Okay, so if I wanted to do another one, I can just do start next treatment, okay? Now that I have finished my treatment, all right, first things first, clean everybody off, okay? So you can do one good swipe of the ultrasound head. Be gentle, be careful. Just kind of take the bulk of that off, okay? But I need to go back and clean that. I'm just gonna rest it up there for now, okay? Fold the towel up, you guys, so you're not rubbing gel all over your patient when you're trying to take it off of them. Scoop, okay? If anybody's got kids, this is exactly how you clean up your kids, right? Use all one towel. Just kind of fold and keep scooping and cleaning. Okay, scoop and clean. Okay, make sure you get all the gel off of your patient. Nobody wants to walk out of there feeling all jelly and sticky. Okay, make sure I got it all. Ask your patient, does that feel like they got it all? Usually I'll give them another towel at the end and have them have kind of the final wipe. Okay, then I need to make sure, okay, that I'm taking my alcohol pads again. I'm going to clean my patient off again. Lovely. Okay, and then I am also going to clean off my ultrasound head at the end. Okay, we are eliminating any chance for cross-contamination here, you guys. If you clean it off at the end of your treatment and then the next person cleans it off at the beginning of your treatment, there is no chance, okay, that we are trying to spread infection here. Okay, that's what we're trying to prevent. Okay, ultrasound head is clean. Lovely. At the end of my treatment, before my patient gets up, okay, we know how fragile this is. I'm going to turn off my machine. Okay, I am going to, as the therapist, go and unplug it. Ooh, maybe. I am going to take my cord away, and I am going to move this ultrasound machine away from my patient. Okay, people are clumsy. This thing is way too expensive. This whole thing is way too expensive to risk anybody knocking into it. So always unplug and move it away from your patient. Clear all cords out of the way before you kind of let your patient get up and walk away. Okay, that is our ultrasound. There are probably some things I forgot, but I will keep covering them in lecture. We'll talk about in terms of sensation testing. I did not do a pre-assessment and post-assessment. There is not really big thermal effects that are happening here. So dermatome testing is not really necessary, but we are always going to do a skin color check. Skin integrity is going to be another one that we're going to talk about when we get to our precautions and contras, and making sure that if you have any measurements you need to take, if you're looking to affect pain, if I'm looking to affect muscle tone, those are the types of things that I need in my pre and post assessment. All right.